Our first one out of 2 bedtime lessons is about the common cold. A cold is very common in mild viral infection. You can often treat a cold without seeing a GP. You should begin to feel better in about 1 to 2 weeks. Symptoms. The main symptoms of a cold include a sore throat, a blocked or runny nose, sneezing, a cough, a funny voice, or generally feeling unwell. Less common symptoms of a cold include high temperature or fever. This is usually about 37 degrees to 39 degrees or 98.6 degrees Fahrenheit to 102.2 degrees Fahrenheit. A headache, earache, muscle aches, loss of taste and smell, mild irritation of your eyes, and a feeling of pressure in your ears and face. When to get medical advice. Speak to your GP practice if you or your child are more short of breath than usual, have pain when breathing in or coughing, feeling confused, dizzy or lightheaded, have a very high or low temperature. For example, you feel either hot or cold to touch or you're shivering, have had a fever for more than 3 days, have symptoms that are not improving or they're affecting your daily life, have a long-term condition, for example diabetes or heart, lung or kidney condition, have a weakened immune system, for example because you're having chemotherapy. Speak to a pharmacist if you have a cold and would like advice and treatment. Treatment for a cold. Sadly, there is no cure for a cold, but there are things you can do to look after yourself at home. You should begin to feel better in about 1 to 2 weeks. Here are the do's and don'ts, but there's only do's in this one. Rest. Do drink plenty of fluids. Do eat healthily. Do take over-the-counter pain relief, such as paracetamol or ibuprofen, to relieve high temperature and aches. Use decongestion sprays or tablets to relieve a blocked nose. And try remedies such as gargling salt water and sucking on menthol sweets. Always read the leaflet that comes with your medicine before taking it. Follow the recommended dosage instructions. If you're not sure which treatments are suitable for you or your child, speak to a pharmacist for advice. Be careful not to use cough and cold medicines if you're taking paracetamol or ibuprofen tablets. They often also contain paracetamol and ibuprofen, so it can be easy to take more than the recommended dose. Now, how do colds spread? A person can start spreading a cold from a few days before their symptoms start until their symptoms have gone. You can catch the virus from an infectious person by touching an object or surface contaminated by infected droplets and then touching a mouth, nose or eyes, touching the skin of someone who has infected droplets on their skin and then touching a mouth, nose or eyes, breathing in tiny droplets of fluid that contain the cold virus. These are launched into the air when an infected person coughs or sneezes. Different viruses can cause a cold. It's possible to have different colds one after the other, as each one may be caused by a different virus. How to prevent a cold from spreading? Here are some do's. Wash your hands often, especially before touching your nose or mouth and before handling food. Always sneeze and cough into tissues. Throw away used tissues straight away and wash your hands. Clean surface regularly. Use your own cup, plates, cutlery and kitchen utensils. And do not share towels or toys with someone who has a cold. Now, is it a cold or flu? It can sometimes be difficult to tell if you have a cold or flu, as the symptoms can be similar. The main differences are that flu symptoms come on quickly, usually include a headache, high temperature, and sore muscles, and make you feel too unwell to continue your usual activities. But however, cold symptoms come on slowly, mainly infect your nose and throat, and are fairly mild, so you can still get around and are usually well enough to go to work. Complications of a common cold is our last part of the lesson. Common colds usually clear up without causing any further problems, but the infection can sometimes spread to your chest, ears, or sinuses. Time for our second bedtime lesson.